Pregnancy. There are numerous health concerns that affect wellness before and during a pregnancy. That is why prenatal care, which involves the combined efforts of health professionals and mother to create a healthy environment for the developing unborn child, is essential to the wellness of both mother and infant. Prenatal care. Ideally, a woman and man attempting to become pregnant should begin prenatal care before pregnancy. Several health considerations should be addressed, including physical health, family history of genetic disorders, drug use, nutrition, and sexual activity. Physical health status. The first consideration is the physical health of prospective parents. The mother and father-to-be need to be at the most optimal level of health possible. This includes eating a nutritious diet, participating in regular physical activity, attaining or maintaining optimal weight, and practicing stress management techniques. Pregnancy and parenting are rigorous experience for both the mother and father. Additionally, the mother-to-be should avoid becoming infected with German measles, rubella, or a sexually transmitted disease, STD, just before or during pregnancy, as these conditions may lead to pregnancy complications and birth defects. Genetic counseling. Prospective parents should determine whether there is a history of hereditary disease in their families. Couples may consider genetic counseling as a means of determining the likelihood of producing a child with a genetic disorder. Such counseling would educate the prospective parents on the nature of a particular disorder and the medical options available to them and their future child. Avoiding drug use. Parents-to-be should consider their use of drugs prior to and during the pregnancy. For males, preliminary evidence indicates that alcohol use 1 month prior to conception may be related to low birth weight of the baby. Cigarette smoking by prospective fathers may also affect a developing fetus, and after the birth will put the child at risk for a variety of respiratory problems. While the evidence for drug use in father-to-be is not yet conclusive, the prudent course of action would be to abstain from drug use prior to conceiving and during pregnancy. Drug use by women attempting to become pregnant is also problematic. It may be as long as 4 to 5 weeks after a missed period when a pregnancy is confirmed. By the 5th week of pregnancy, the artery that will become the heart is already beating. The embryo, fetus, is most vulnerable to chemicals during the first 12 weeks of pregnancy. Potentially harmful chemicals can be introduced to the embryo, fetus via the mother's blood. One such chemical is alcohol. Alcohol consumption during pregnancy has been linked to an increase in spontaneous abortions, as well as congenital heart defects, retardation, physical malformations, and other deformities. Select congenital defects produced by the mother's consumption of alcohol are referred to as fetal alcohol syndrome, FAS. Any congenital defect caused by the mother's alcohol consumption is referred to as fetal alcohol effect, FA. Maternal alcohol abuse may be the most frequent environmentally known cause of mental retardation in the Western world. There are many other chemicals commonly used that may cause problems for the mother or embryo, fetus. The antibiotic tetracycline, if taken during pregnancy, can cause staining of the infant's teeth and stunt the growth of long bones. Other antibiotics may cause congenital cataracts. Chemicals from tobacco smoke increase the risk of spontaneous abortions, stillbirth, low birth weight, and ectopic pregnancies. Excessive amount of vitamins such as A, D, and B6 have also been associated with fetal defects. Additionally, although not drugs, pregnant females should avoid X-ray radiation and hot tubes. Nutrition during pregnancy. The average pregnant woman needs to increase her intake of calories by about 15% so that her minimum daily count is about 2,400 calories. Maternal weight gain during pregnancy is directly related to infant birth weight and by association to length of gestation, fetal growth, and infant mortality. Another factor is age, where teenage mothers are less likely than women in their 20s to achieve the minimum recommended weight gain. In addition to more calories, the need for protein, vitamins, and minerals also increases. Although many physicians prescribe a vitamin, mineral supplement for pregnant women, this does not negate the need for a well-balanced diet. Pregnant women need to pay special attention to their food intake regarding protein, iron, calcium, sodium, and B-complex vitamins. Benefits of prenatal care. Prenatal care increases the chances of a mother bearing a healthy, normal weight baby. This is an important benefit, as birth weight is an important predictor of infant health status. Specifically, low birth weight is strongly associated with infant mortality. Prenatal care will also allow for the detection of potential and actual pregnancy problems. For example, one tool in prenatal care is ultrasonic fetal examinations. Ultrasound machines can produce an image of the fetus using relatively harmless sound waves. These tests can provide data about how the fetus is developing and whether any medical attention is required to treat the fetus while in the womb or soon after birth. Amniocentesis and chorionic villus sampling, CVS, are used to diagnose chromosomal abnormalities and other defects. These tests are often performed early in pregnancy, between 10 and 13 weeks for CVS and 16 and 22 weeks for amniocentesis, to check for Down syndrome and other genetic problems. For mothers with multiples, these tests can also determine whether babies are identical or fraternal. The physician performing amniocentesis obtains a sample of the amniotic fluid. A needle is inserted through the abdominal wall and a sample of amniotic fluid is withdrawn. The results of the test can take from 2 to 4 weeks to prepare. The proportion of mothers and fetuses that suffer ill effects from amniocentesis is less than 1%. It is possible that a healthy fetus may be spontaneously aborted as a result of amniocentesis. Candidates for amniocentesis are parents with a family history of genetic disorder, women who have borne children with birth defects, and pregnant women over the age of 35. Chorionic villus sampling involves obtaining a sample of the chorionic tissue through the vagina. On the positive side, this procedure provides information about fetal genetic defects earlier than amniocentesis. On the negative side, there is a concern that this method carries a greater risk of spontaneous abortion than amniocentesis. Kathleen D. Mullen, Robert J. McDermott, Robert S. Gold, Philip A. Belcastro. Connections for Health. 4th ed. Brown and Benchmark.